everybody, it's Dr. Francine from the Chiropractic Center, where we really care about you and your success. And today I wanted to share with you what happens when your spine, if you've been told you have arthritis or if you've heard the term disc herniation, what exactly happens. So I've got my models here and I've got my spine. So the first thing I think that everybody should know, and most people understand this, is from the back, your pelvis should be level and your spine should actually be straight. What a lot of people don't realize though is from the side, your spine actually needs to have curves. And those curves are designed to create a lot of structural integrity and strength for your spine. Now, what happens though, for various reasons, it could be lots of little repetitive things like looking down at your phone over and over again, or it could be a slip or a fall that you had, that can cause the spine to shift out of alignment. And a lot of the times, when people are talking about arthritis, I always say, all of the joints in your body and all the discs in your body are the same age. So why are some of them wearing down faster than the others? And that's something that we need to look into. So if you were to look at a normal healthy spine, I think you can see that. There's the disc. So I always tell patients that the disc is like a big jelly donut. There's the jelly part on the inside and there's the doughy part around that protects the jelly part from oozing out. If you look here very closely, another thing that a lot of people talk about is stenosis. So if you can see here that the nerve comes out of the holes between the vertebrae. So these discs act as a shock absorber. They also keep the space open here. And then if you look in the back, you can see how these vertebrae are moving quite well. So these are the joints. If you've been told that you have arthritic joints, you might want to check out and see what these joints look like in here. Now, unfortunately, over time, and people assume that you're going to have pain right away, and that doesn't necessarily happen. Only a small percentage of our nervous system is designed to pick up pain or tell us that there's pain. Our body is far too busy keeping us alive, digesting our food, and other things like that. But here, if you can see, so if the spine stays out of alignment or structurally there's more stress on a part of the spine, what you'll start to see here is there's the disc there, and I don't know if you can see that, but it's almost like the doughy part starts to fray a little bit around that area when there's additional stress or strain to that part. What'll happen is the shock absorber here, the disc, will start to get a little bit more narrow, and that's the beginning phases of arthritic change or degenerative disc disease. The nerve hole then will be more narrow than it was, and you still probably will have pretty good motion at that stage. And that's why it can be quite deceiving. You might have some discomfort, you might still be able to move, but the spine is starting to degenerate very, very slowly. Now, if you look here, this is what happens as the disc continues to degenerate. You're going to see that the doughy part, if you kind of liken this to a jelly donut again, starts to fray even more. And that jelly part is at risk of kind of moving out. And then what it can do is, as it moves out, if it herniates, it can actually block that nerve hole in through here. And the body perceives that inner part here as a foreign substance, and it attacks it. So there's tons of inflammation around there. And that's why if you have sciatica or a disc herniation, it can be very, very, very painful. If you look at the joints in the back here, you can see that the joints are roughened and there's definitely not as much motion there. And then if you look on this side, you can see, I don't know if you can see that, but the nerve hole is even much more narrow there. So that's where you start to get into stenosis. Stenosis can happen around the nerve root here, but it can also happen right around here when you look at the spinal canal space. So if you compare it to that one, where the normal one, you can see how much more narrow that is. If arthritic change or degeneration continues, the disc actually starts to look more like this, where there's not a lot left of it. You can see that there's these big spikes that start to grow along the sides of the discs here, and the poor nerve has very little space in here, and the spinal cord also can be impacted by that too. So when you look at the spine, oftentimes degeneration happens over a long period of time. It doesn't have to be something that happens quickly. It doesn't even have to be anything that's painful in the beginning. And that's why making sure that the spine has proper alignment, both from the front, the back, and the side, that will help to protect all of those joints, all of those discs over time, and make sure that your body has the right nervous system supply and is able to function effectively. So I hope that you found this very helpful. If you'd like to share that with somebody that you know might be suffering with some back pain, or might want to learn more about what happens with discs and arthritic joints, go ahead and do that. As always, you're welcome to comment, and I look forward to seeing you next time. Have a great day, and let your healing begin.